Let's talk about all of the entities that were involved in coming up with this new plan. Tell me a little bit about that.
So we've been working with epidemiologists and scientists and other, leaders within the science field to really know the facts of what makes the safest possible entry into work.
What was your main goal in formulating this plan?
Well, the goal was to make sure that we would be protected as we re-entered into, back into work. We need certain protocols put in place. Our industry is different than any other industry. We are a large amount of number of people in very intimate spaces. For our members, there's no PPE available unless you're doing a show on, something catastrophic as a pandemic. So everybody's wearing masks. And because of that, we had to make sure that we were setting the protocols based on facts rather than everybody kind of arbitrarily putting out what they think, would be satisfactory. We wanted to make sure we were dealing with the science. So PPE is going to be available to most of the crew. That's not so for the actors. So as a result, again, as we went through all the different groups that are there, we created a zone system within the document, which really deals with establishing barriers, so that everybody's not all in the same space all at once, that the people who have the highest risk to exposure are put into an area and, that is actually separated from everybody being together. What we're hearing from, the CDC, testing. So we really need to have that frequently done so that we can help to monitor, because you can't have a safe set. You can only have a safer set. So that's one of the things that'll be required. And then we just have to make sure also that we have the proper physical distancing taking place, because we don't have the ability for everybody to have PPE. So that was those are the three things in terms of the zone system that were really important for us to establish. It's very comprehensive in terms of everybody who's involved with it. The government might say things are open, but whether they're open or not, we had to make sure that there was a structure that would be safe, right? To go and say, okay, everything is open. They wanted to open production. We said, wait a minute, we need to make sure that we are all in agreement of what that looks like. So we're really hand in hand working with making sure that the protocols and procedures that are put in place, the guidelines that are set up, will go and help us as we move forward. But I think that really a lot is going to be defined also by people's willingness to work. Some people want to get right back, and others are saying, I'm not ready. I don't know enough yet. And we have to respect that. People need to feel empowered to make their own personal choices. We just want to make sure if they make the choice to go on set that they feel safe, or safer. But the real truth is, I don't think we're going to have a boon of production right away. What we've created is, again, a baseline, and that will keep evolving as we get informed. That being said, I don't know that people are going to just jump right back in.